About asthma and respiratory tract infection in children, and Dr. Evelyne, is it Evelyne or Evelyne? Either or. Dr. Evelyne Gisa is here, of course, helping us understand all about asthma and respiratory tract infection in children. And if you have a question, of course, we're inviting you to be part of this conversation. You can call in live on the number that will be on the screen shortly. Now, Dr. before we went on that very short break, you're talking about, of course, spirometer, how it's used to test and, see asthma and how far it has gone in the lungs. But you also talked about inhalers. You said we have one that is used for the mouth. But I have a concern. There's one that we see that is being used on the nose. How different is it from the one in the mouth? Okay. I used to see it a lot in high school.
In high school?
Yes.
In the nose? Well, so the nose one is supposed to help the nose blockage. It's not supposed to help with the asthma. So that one is sprayed directly to the nose. So if there's maybe nasal congestion, nasal blockage, snoring, we'll prescribe a nasal spray. Then the mouth one is for inhaling into the mouth. So because young children below 6 years have trouble coordinating the breathing in of the inhaler, we give them a gadget called a spacer device. I should have come with them actually.
Yes. Next time.
To demonstrate. So we have a spacer device that we deliver the inhalers through that for younger babies and children below 6 years. The older ones, we usually are able to teach them how to inhale the medicine. So that one goes to the mouth, straight into the lungs. They inhale it, the medicine. It's a meter dose inhaler or a dry powder inhaler or a tube inhaler. There are different types, different devices. All of them enter through the mouth. And the babies, we just put a device that's a spacer to allow them to breathe. They are a type of natural breathing.
Okay.
So that the medicine goes into the lungs. Some of them are usually crying and resisting, so it's very difficult to deliver the medicines.
All right, we'll be coming back to that. But let's hear from Catherine. Catherine is calling us from Busia. Good morning, Catherine.
Yeah, good morning too.
Yes, talk to us. Catherine? Yes, talk to us.
Nilikuwa nasema mtoto anatoka na anakohoa sana, halafu kifua unasikia tu akipumua, anasikia tu akipumua kwa kifua. Halafu anasinifu, anakohoa. Sasa alikuwa anashindwa, tena nini dawa gani ndio inaweza kuwa mzuri kwake.
Okay. Asante sana Catherine for that question.
Okay.
Mtoto anakohoa, anashindwa, dawa inaweza kuwa gani? Persistent cough.
Okay, so persistent cough has a lot of causes. So we have the infections and then now the asthma. So sorry, I didn't hear the age of the baby.
She didn't say.
The child.
Is she still there, Catherine? All right.
So if the child is very, very small, then it's usually one of the infections or the allergies. So I would recommend maybe she'll call later, we can hear about the cough. Is it a productive cough? How old is the child? Has there been fever? Is the baby growing well or not? Because we also in a TB endemic country, and it is one of the causes of a chronic cough or a persistent cough. So, and it also can cause noises in the chest. So I'm not sure if she is already gone to the healthcare provider to assess and categorize in which direction is this cough going to. If it's a cough triggered by cold or the usual infections, or there's a trigger, then we usually call it asthma-related coughs or allergy-related coughs. And the treatment, usually we use the inhaler medicines. However, if it's due to TB, then it's good they go and get a sputum and check so that we treat the TB. Or if it's due to swallowing problems, then we actually address that. It helps to prevent the chronic cough. So a lot of airway problems can be due to the systems near the lungs. So the nose, persistent nasal congestion, reflux, and also heart problems. However, when they go to the medical doctor, she can advise whether they need an X-ray or to see another specialist who can be able to see which system is causing this persistent cough.
All right. Catherine, you can call in again. Daktari anauliza age ya mtoto.
Yes.
But let's hear from Basibo. Basibo is also calling us from Trans Nzoia. Good morning, Basibo.
Good morning to you.
Yes, talk to us.
First of all, I wish to appreciate the program.
Thank you.
It's quite educative. My question is,
Yes.
I don't know what my problem is because
Yes.
each time I engage in a very small exercise, I get chest congestion. I'm unable to breathe. It is very difficult for me to undertake any other exercise thereafter. I've never known what my problem is. I wish the doctor to assist me there. Then number two, I'm actually a teacher.
Okay.
I'm a teacher at Anderson High School. And during the cold hours, I experienced the same congested nose to a point that I'm unable to speak or to teach my students. But when it turns out to be warm, I'm quite okay. The clogged system, nasal system are okay, and I'm able to do well. I've not understood what the problem is. Kindly assist.
All right. Thank you so much, Basibo, for joining us and for being part of this conversation. You also have the adults coming in, and you've had his case.
Yes.
Yes.
So thank you, Basibo. So the presentation sounds like it could be an allergy-related presentation. So because